Welcome to the Arter Project podcast. I am your host, Nick Arter. Today we're joined by none other than Peter Reitano, the founder of Gwella Mushrooms. Peter, how's it going today?
I'm good, man. Thanks so much for having me on.
All right, Peter, if you could just talk a little bit about your personal experience and how you started Gwella Mushrooms. Gwella Mushrooms is a health and wellness company that focuses on using mushroom products to better serve individuals' personal development as well as health and wellness. So Peter, if you could just talk a little bit about that company.
Sure. Yeah, I mean, I've been building products and brands for probably 15 or so years, a lot in the health and wellness space, some for other people through my agency work, but a lot of my own as well. Most recently, I've done a bunch of work in cannabis, built some brands there in Canada and in California. Really enjoyed that, really liked the space. And, psychedelics came about for me because one, I have a personal interest in them. I've used them a lot. Growing up in the UK, there was a brief window of time where they were legal. So I was exposed to them very early on at age 16. So I've always been really interested in their transformational potential, but also just like the history of use and, what people have been doing throughout society and throughout the ages with them. But then also, I wanted to build something in psychedelics and wellness that was a little bit different to what I saw was going on in the rest of the space. I mean, there's, about 3 years ago, when I started to think about what this company could look like, I looked around and the majority of companies were essentially medical with kind of two offshoots, biotechnology and clinics, but both talking about psychedelics from a very kind of prescriptive, pharmaceutical, how do we take these substances, turn them into drugs and fix, serious clinical disorders. Now, the way I wanted to approach it was, I think there's a lot more to these substances than just fixing disorders. Clearly, I think, it's really exciting what's going on the biotech side. And I think we're going to get a lot of interesting treatments and mitigate a lot of suffering. But I fundamentally believe that there's more to psychedelics than fixing disorders. And so Gwella's aim really was to recontextualize and reconfirm these substances as tools to create, not just drugs to fix. And we wanted to create a company that improved access for everybody to use these substances for whatever reason, not just inside this very gate-kept, streamlined kind of system of clinical and drug development. So that's where it came from. We're like a personal interest, but also a want of mine to really create a company that was, improving access and speaking about these substances in a little bit different way to most of the companies out there.
It makes a lot of sense, Peter. I have to tell you, that's really incredible. You're doing some really incredible, really dope work, man. Definitely hats off to you. So can you just talk about, how the space has shifted? I mean, it's been such a fast and quick adoption. It seems that, it's getting introduced to mainstream culture. 2021, 2020, just it's exponential growth. Can you talk about, some of the hurdles that you had early on with starting the company and how you are seeing, as it gets more and more adopted to mainstream, how that shift has impacted the business?
Yeah, it has been a crazy rapid growth. I mean, it was only 25 years ago when Johns Hopkins and people in MAPS really started to pick up the baton after the war on drugs and started to do this research. But it was very much like niche academic and not for profit. Rick Doblin was very much, he wasn't the celebrity that he is today. It was, very much kind of this, it was very much this kind of kooky, hippie research that was going on. And I would say really only the last 3 years have we seen this explosion, this kind of quote unquote renaissance. And, the way I think about it is, that word renaissance, kind of renaissance for who? Because, there's been a culture in the West of using these substances, certainly since the 50s, and that hasn't gone away. People, hippies and all of this type of stuff have used these, artists, et cetera, indigenous populations, of course, have been using these things for a lot longer. So there's no renaissance there. There's been a continuity of using But where there has been this kind of re-interest is within the scientific community and within the therapeutic community, because there's been, starting to see a loosening of regulations, which is allowing capital to flow into the space and people to make investments in the space in these types of companies. And so we've seen this kind of reinvigoration of the scientific interest because regulations are loosening up, and then because of that, capital flowing into the space and companies being built, like I said, largely in the medical side. But I think that's also just, the way these things typically move is, first off, you need to show that there's medical utility to get it through the FDA. That's like the thin end of the wedge. And then over time, you can kind of break down even more regulations and liberalize further, like we saw with cannabis. I mean, it's just a kind of quirk of the system that for whatever reason, we need to show that a drug can fix a disorder rather than, just be cool and raise people's consciousness or whatever it is. And so I see it as like the first step going through this. But over time, we'll see, progressive movement towards more liberalization and legalization, where people can get access to these things for whatever reason they want. In terms of hurdles in creating a company, I think we took on a pretty strong position early on that I don't want to say ruffled feathers, but it's definitely different to the consensus. I mean, we came out of the gate talking about cognitive liberty. Like, this is the kind of the idea that everybody should be able to experiment with their own consciousness without interference from the state. And we don't think it should just be within clinics or these kind of systems where it's controlled by large corporations. And we think it should be more decentralized and have more access points. And so that was a different narrative to being taught. We've talked about consumer access versus just kind of pharmaceutical drugs. This is consistently for investors is difficult to get their head around. I mean, we're still very much in this 1.0 where people are focused on how do I build a drug that gets FDA approved. I would say those are kind of minor challenges, but I like that because it shows we're doing something a little different. And then there's all the usual kind of crap that you deal with when you're working in a business that's emerging. Same with cannabis, you have banking issues, PayPal shuts your account down, all of that kind of, you can't advertise on platforms very effectively. Double blind gets shut down all the time. So there's a bunch of little annoyances in there, but really it's, for us, it's been a fun ride. I mean, we enjoy building brands. We like the products we're building. We're doing something a bit different, and we're all passionate about it in the companies. And now we're seeing all of this, rapid change come through. Like we were talking about Washington before, like I just saw a ballot initiative tabled for adult use. So not just therapeutic or not just decriminalized, but adult use access. I mean, these things it's happening really fast. And I think we're going to see a wave of, we're already seeing a wave of decrim, but, more and more markets, but more and more access across the states open up. So it's a great time to be in this, business, this space.
It's incredible, man. And I'm here in Washington, D.C. and just getting to see the movement. The folks over at Decrim Nature are really doing incredible work, all across the country, though, really just to try to, really push legislators to do the right thing. I have to agree with you, Peter. I'm big on cognitive liberty as well. Graham Hancock talks a lot about that. I'm a big Graham Hancock fan. He talks about, we deserve the right to have ownership over our own consciousness. Right. I think that's absolutely ridiculous, but, that's the work and that's the challenge people, like you are involved in help pushing that message forward. I just want to circle back a little bit to your own personal experiences with psychedelics and plant medicine. Were you introduced to these substances through, were any type of mental health issues, or, was it kind of just a hobby? And, how did that impact and change your life on a personal level?
Yeah, I've been lucky enough, I've never really suffered from serious kind of mental health issues, always had, very happy, trauma-free childhood in the UK. I really came about psychedelics, I'd say about 13, 14, we started getting interested in, me
Wow.
and my started getting interested in, like, rock music, Jimi Hendrix, and, all of that kind of stuff, and getting in through that kind of 60s rock introduced you to the idea of psychedelia. Cannabis comes first. It's more of an access point. So we all got really into weed. I'm not saying at 13, 14, but like around 16, but just before then, music, culture, things like that started to penetrate our young minds. And then by the time we had, started playing around with cannabis and, getting more into that stuff, psychedelics was just a
Natural.
logical step that we wanted
Yeah.
to explore. And I was lucky enough to be in a time zone in England where they were legal, so we could go into a store and buy magic mushrooms completely legally. You just go to your head shop. Ours was called Salamanders, so we go into Salamanders, buy like a pouch of mushrooms that was essentially like a hero's dose of mushrooms, and then we'd go off into the woods without any guidance or anything, and just take these massive doses of mushrooms. And
That's incredible.
some of the it was some of the most profound experiences of my life, but also some really terrifying experiences, which I'm sure we've all kind of gone through. But it was a really kind of haphazard way of getting into it, but really kind of deep and meaningful, and that just sparked an interest in. I was just like, wow, I didn't know you could feel this way, think this way, have these kind of experiences, and ego death and all of that type of stuff. And so
Yeah.
that just sparked a kind of lifelong interest in these different plants. And so I started to use a tool called Erowid, which is a kind of drug database online, and it's got these amazing experiences that people have been documenting for 20 years. So like, people will take some MDMA and they'll mix it with, I don't know, cannabis, then they'll write down the dose, they'll write the experience, whether it's positive or negative. And it's just this treasure
Wow.
trove of research. And so I started using that, and I started just buying random plants like Hawaiian wood rose seeds that has LSA in it, and taking them, seeing what happened. And yeah, just thoroughly enjoy the experience of altering my consciousness and what it can bring to me. So that's stayed up to today. I've never had a therapeutic kind of guided experience. I really want to experience a kind of, an ayahuasca session with,
Yeah.
somebody, with somebody that knows what they're doing. I want to explore all of that, but up to this point, it's largely been self-guided, with kind of friends that know what they're doing, things like that. So
That's awesome, man, on so many different levels. So for one thing, you mentioned early on, and having those challenging trips, as well as the beneficial consciousness expanding trips as well. So I'm glad you mentioned that, because that does happen, and that is something that people do have to be aware of before experiencing psychedelics. It does happen, and it's challenging, but it doesn't necessarily negate from the entirety of what psychedelics can do for you. And often people learn a lot from
right,
challenging trips as well.
they do, and just kind of to add to that, there's ways to optimize for more positive experiences or mitigate downsides that I just wasn't aware of. And that's what part of the mission of Gwella is. The way I look at the company is somewhere between rolling the dice with your buddies like I did, which can work out well sometimes, doesn't always though, and then on the other end of the spectrum, sitting under in a Soho House style medicalized clinic. Somewhere in that middle ground is where Weller wants to play, where it's responsible, intentional usage that's a little bit more structured than what I necessarily did. Not saying that's wrong, but also not all the way to this kind of hyper medicalized clinical approach. So, if I think back to my experiences, it definitely would have helped if I sat down and thought about intentions before, and thought
Yeah.
about my kind of mental mind space, or maybe watched what I eat a little bit more, or thought about the people that I was with. I mean, most of them were good friends, but sometimes they always weren't. So just kind of setting and intentions and the integration afterwards and your diet and what you're doing before, all of that stuff matters a lot. And so that's the kind of education I think is a little bit bereft on the market.
Now, tapping back into Gwella a little bit, you mentioned early on also in your being introduced to psychedelics, learning different plants and learning, experimenting and learning different plants. One thing that I find interesting about any entrepreneur that starts a company like the one you did, the education gap or the learning curve, if you're not a mycologist, if you're not a botanist, can you talk about learning, the kind of the science of these plants in order to start this company and what that was like?
Yeah, I mean, so I've been interested in mushrooms really interested probably for, I'd say 7 or 8 years. So I've been, growing them, inoculating logs, doing all like functional edible ones, as well as, playing around with kind of psychedelic stuff. So
Yeah.
my learning has been, hands-on. What do these things do? What does it take? But I'm not a scientist. And so I was lucky enough early on to meet our chief science officer, Daniel, at a
Awesome.
online conference. And he's really like the science backbone. He has a research facility and properly interested in mushrooms for, I'd say 6 or 7 years. Whether that's, I started growing them first in, sawdust little bags that I would then slice and mushrooms would go out of them. But then I'd start getting logs, drilling holes, inoculating them. And so my learning with mushrooms has really been, cursory consumer reading and then experimenting myself and reishi, for example, and then boil it and make my own tea out of it. So it's been very hands-on, making my own kind of health and wellness products from it. But on the science side, I was lucky enough to meet our chief science officer at an online conference very early on in Gwella's life cycle, and he has a research facility. He, is a geneticist and all of that type of stuff, and so he really takes on the side of the hard science and the product development. And we also have someone called Erin, who's a co-founder, who is a permaculture expert, kinesiologist, has grown mushrooms in various different communities.
So, Peter, I did want to ask you just about any type of difficulties that you may have had starting Gwella Mushrooms without necessarily having a background in mycology, and starting a company based around mushrooms. Mm-hmm. Were there any challenges? Did you had to hire like an external research team, or can you just speak a little bit about that?
Yeah, I mean, so it was my passion that initially drove me to wanting to start this kind of hobbyist interest in growing mushrooms. I've grown them for a long time. I've played around with the various different products that are out there. So I had like an amateur view on this, and I knew kind of enough to know what I wanted to build, but I didn't have the skill set. I'm not a scientist to do this stuff myself. So one of the first people that I was looking for really was a chief science officer that had experience with, food science, mycology, and hopefully psychoactive compounds. Now, just as luck would have it, one of our advisors, Dr. Keaton Patel, he's a therapeutics doctor. He was attending a conference and he started to chat with what became our chief science officer on the side thread of the conference, basically, shitting on whoever was speaking at the time. I can't remember what he was saying, but critiquing it and connecting me with Daniel. And, Daniel has a long history. First off, he's kind of a biochemist and genetics expert. He's worked with cannabis, CBD, all sorts of different kind of gummies and edibles and things like that. Wow. So he's done this work for a long time. He's also, done some work with psychoactive compounds, and so we hit it off immediately. He's got a lab based in the US, an extraction facility and a food science and co-packing lab. And so he came on board as a co-founder and started to, we started to jam on ideas. And it's been a great relationship because, all of the early ideas and products were basically me and him kind of jamming, like, oh, wouldn't it be cool if we did this? And, I don't know how to do that, but then he could, riff on it with me, like, okay, we can do this, and I've tried this, and I've got a recipe for that. So, for example, Mojo, the legal microdose, we were jamming on, oh, wouldn't it be cool if we had like a productivity or an energy gummy made of natural ingredients with some mushrooms in it. And it just so happened he built one 10 years ago when he was at school looking to create a kind of Adderall replacement. So he had this recipe. It wasn't the final recipe that we've ended up using, but he had this kind of idea, brought it in, and we've been, adjusting it and iterating on it for really 2 years now. And so that's where a lot of the scientific stuff came from. And then we also brought on Erin as a co-founder who, is interested and is qualified in kinesiology and permaculture. She spent time with indigenous populations, growing mushrooms, things like that. And so, she brings that kind of that health, wellness, indigenous kind of angle to the table. So we've got a pretty stacked team now when it comes to product and science that takes care of a lot of the, actual rubber meets the road execution on creating these products and getting them to market.
Wow, that's amazing, man. That it's interesting. I hear a lot of my story in your story as well. That's very entrepreneurial. Sounds like, to be able to even, just locate a chief science officer and begin building, and just getting your ideas to manifest with working closely with an expert. Being an entrepreneur myself, like I 100% relate to that. And that's what my personal opinion is. That's what I think we kind of need in this space is we need, the idea guys, we need the entrepreneurs to also kind of mix with all the benefits and just potential that psychoactive compounds can bring. Now, with that though, Peter, there is also some type of, there's some type of controversy that is within this space with people like us who are entrepreneurs and really want to bring these things to market. Can you talk a little bit about, for instance, you mentioned, just in general, just having a natural compound, it's difficult to patent, a natural compound. And there's a lot of, different conversations about this. Could you talk a little bit about, any struggles that you've had to patent these compounds or, whether or not you think spiritual compounds, mixing spirituality and something so sacred with business. Can you talk a little bit about that?
Yeah, I mean, there's two threads to this that I think are worth pulling on. There's this kind of discussion of capitalism and productizing kind of mushrooms and what really was sacred medicine and still is sacred medicine for a lot of people. And then this idea, take it one step further of commoditizing and kind of gatekeeping through the patent system. So when we created Gwella, we wanted it to be, I'm a big fan of kind of decentralization, open source, things like that. And so, I wanted to create a company that was trying to improve access to them, but not gatekeep them. So I'm definitely, I'm a capitalist, kind of libertarian. I think this is the mechanism through which we bring products to scale, and all of that type of stuff. And so I don't have any problems with productization. If we want more people to get in touch with these things, we need to scale it out and reach people and educate people. Having said that, I think there needs to be a lot of, it needs to be sustainably done, and it needs to be, there needs to be what's called reciprocity and things like that. So, how do indigenous cultures benefit from this essential, this knowledge that they've got, or other cultures, not just in the kind of Amazon or whatever it is, but also, how do we do it in a way that's not predatory and doesn't ruin environments? So a good example of that is the chaga mushroom. For a while, as it became more popular, harvesting techniques were pretty pretty bad, and it only really grows in northern Canada, Siberia, places like that. And native populations use it a lot, but they harvest it in a way where they snap off a little bit, don't take the whole conch, so it regrows. But as more and more people wanted chaga, people were just kind of harvesting it, ripping off the full thing, and we were kind of devastating these mushroom populations. And so we need to be very mindful of that. The patent question is a whole other question, and there's really interesting conversations around it. First off, I would say patents are sometimes needed for innovation. That's the kind of argument where somebody creates something novel and useful, and they want to protect their intellectual property, so they patent it for a period of time, and then that allows them to recover their investment. Now, there's some great arguments even against that in the kind of libertarian community, that patenting is just kind of government overreach and crushing competition and things like that. I think sometimes there's a good argument to have a patent, but I think what a lot of companies have done in the psychedelic space is doesn't fit that kind of novel, useful requirement. So Compass Pathways is a good example. They've got a slew of patents in play. I'm sure some are valuable and useful and original, but some are just completely outrageous. I mean, patenting psilocybin while sitting on a couch, while listening to music, while there was this kind of 20 or so, and a lot of them are going to get squashed. And they've been fighting. There's a big battle coming up between organizations like USANA and Compass, where these kind of not-for-profits are trying to get psilocybin out there for the people, because they're essentially generic drugs, and then these for-profits that are trying to patent natural substances, essentially. Maybe, and then some people are some organizations are changing one little not even molecule. They're doing what's called they're making them heavier molecules, and so it's a way to change it slightly but not actually change it very much, so that then you can apply a patent to it. So there's a lot of shenanigans going on out there. I don't think you should be able to patent psilocybin. I don't think you should be able to patent peyote. I don't think you should be able to patent on any of these. And a lot of these techniques for extraction and synthetics were created 50 or 60 years ago. Tim Leary and all of these kind of people. So a lot of this stuff that's floating around out there and tweaking a little bit now is really just ripping on old prior art. But then there are some companies like psychedelics are trying to create a non-hallucinogenic psychedelic, which may be a bit of a contradiction, but that's definitely novel. Whether it's useful or not, TBD. So I'm sure there's some arguments out there, and there definitely are companies doing novel and interesting and useful work, but a lot of the patenting to date has been quite predatory and not particularly great for, I think, just the general population who just want access to this stuff. I would also say there's a lot of talk about next generation psychedelics, and we are going to see a lot of kind of interesting novel next generation psychedelics, which is great for treatment of mental health. But next generation is also it's also a way to justify raising money, kind of public market valuations, because you're creating something new, whereas actually what we really need is just better access to existing psychedelics. We've got the plethora of psychedelics out there.
Focus on that first.
Yeah, let's, we've already got DMT, we've already got peyote, we've already got psilocybin, we've already got all of these amazing substances. Let's just get better access to all of that stuff and work out how to use it properly, or not work out, but we've already got guides and all of that type of stuff for how people have been doing this for a long time. So if we truly want to help people, I think, the easiest way to do it is just allow more access to the existing stuff we've got. Of course, that doesn't make as much money for large kind of pharmaceutical companies.
Mm-hmm.
Pharmaceutical companies want something that's patentable, that's defensible. So it's going to be interesting to see how things play out, for sure.
Yeah. Peter, and that's kind of, I agree with your answer 100%. I mean, that's kind of what I try to talk about here on the Ardor Project. I understand, the history of these compounds. They do have a sacred history, especially with in minority communities and across the world. And what I try to do is try to educate people on the publicly traded companies. Figure out how everyone can get involved. Because capitalism is the only way it's going to scale. So we do have to partake and participate in that. So I try to educate people as much as possible on these publicly traded companies, and there's great opportunities out there. Hearing about Gwella and how you started your company, that's incredible also. I think everybody should just not necessarily be deterred by the fact that there's money that can be made, but figure out how to, use it as a tool to scale. And we really bring these substances to the mass population. Before we wrap up, Peter, let's just talk about the future of Gwella and the future of psychedelics, and how do you see the next 3 to 5 years? I know you're in Canada, and Canada just recently approved psychedelics for terminally ill patients. I know that was some pretty big news here recently. So could you just talk about, the future, and where do you see the industry going, and where do you see your company going?
Yeah, I mean, I'm really excited about the future of psychedelics. We've seen enormous change over the last few years, a lot of interest in it, a lot of loosening up of regulations, liberalization across the US, decriminalization movements. Then in Canada, we've seen these exemptions start to come through from Health Canada that allow usage of these substances for treating various different ailments, and that's always kind of the bellwether of further legalization and liberalization. Education, medical uses, and then people will press more and more for that freedom to access. And so, I think eventually we'll see full decrim, full legalization. It'll be interesting to see how it's all commercialized, whether it's like cannabis or not. But I'm very bullish on the world becoming more enlightened as it pertains to drugs and how we treat drugs and how we treat people that use drugs. And so, the war on drugs kind of slipping back, receding, and people having more access to more of these natural supports, I think is very exciting. I think we'll see a bunch more companies pop up. I think we'll see a lot of consolidation. A lot of the public companies in Canada are, complete crap. I think there's a lot of, good companies as well. But Canada has this very peculiar public venture capital, venture exchange system where we have very small companies going public and essentially on a kind of deck and a story. And I think there's just a lot of garbage in the system, and it's going to get consolidated out. A lot of the names are going to disappear. But there's also a lot of really good companies. Like, one of my favorites is from the UK, Awaken Life Sciences. You've got Ben Sessa, Professor David Nutt. They've got ketamine clinics, but they're also working with MDMA and things like that. And so there's some really exciting companies out there as well. So I think we'll see a lot of consolidation. I think we've seen this burst of energy, and then we'll see a focus on the quality players out there, which are now becoming kind of obvious, certainly on the public markets. And then for Gwella, our plan is really, keep growing, keep putting products out. We've got a couple more flavors being released for Mojo in the next month. So we'll have three flavors altogether. We want to expand geographically, selling it right now. We sell in the US and Canada. We're putting out a few more what we call psychedelic journey tools. So tools people can use at home for a psychedelic journey, that, we're not going to be selling psilocybin anytime, in the next year, because it's obviously illegal still, but thinking about all the different tools people need at home or with their friends to use these things and get better experiences. So all of that's going to start coming out in the next 3 or 4 months. We've got a really interesting report on microdosing where we've kind of interviewed a bunch of people. We've collected a bunch of data on how people are using these substances. So we'll be releasing that in the next few weeks. We'll have a new Gwella website. We'll be releasing new products, and we just want to be, at the part of this movement, producing products that people love and continue to grow and continue to kind of raise the flag for accessibility and open source. I think this is just it's a very gratifying, fun battle to be on. Pushing for accessibility for people versus I want to make these drugs and then sell them to you through a very clinical system. And I think the future of this psychedelic stuff is really, I hope, multidisciplinary access, where if people want to go to the forest with their friends, they can do that. If they want to go to a shamanic guide, they can do that. If they want to go to a chic Soho House, Brooklyn clinic, with $7,000 ketamine treatments, they can do that. If they just want to use it at home with their friends, they can do that. We need multiple access points for people to be able to use these substances safely and effectively. And so I hope that's the way it's going to move, rather than one kind of system where everyone has to go through.
That sounds like an incredible future. Like I would love that. I'm bullish on, I guess, the evolution of humanity as well. I do think it's not a matter of when, or not a matter of if, but when these things happen, and they're needed, man. Peter, you've been a great interview guest. So much information given throughout this episode. Just before we wrap up, if you could just let my audience know where they can find you. And where they could find additional information on Gwella as well.
Yeah, so you can. So first off, pleasure to be here. Thanks so much for chatting with me and inviting me on. You can find info on Gwella at gwellamushrooms.com, and then Mojo, you can just go to mojo.shop if you want to try Mojo, the product. It's available in the US, Canada. There's a code out there, I think welcome 20. So for your first order, you can get 20% off. And then me personally, LinkedIn, Twitter's probably the best places. Twitter, my handle is DigiDharma, but you can find me by searching Peter Reitano. I'm pretty active on Twitter. So those are the best places.
Cool. Peter, appreciate it. Really appreciate it. And that wraps up this week's episode of The Arter Project. Don't forget to check out thearterproject.com for additional resources on psychedelic content, psychedelic business news, as well as latest medical studies and results as well. So with no further ado, we'll go ahead and wrap up.
Thank you.